Okay, I'm scanning the room. All right. Hi, Mr. Miller.
Yes.
Hi, my name is Courtney. I'm going to be your nurse today. Today we're going to perform a head, ears, eyes, nose, and throat assessment. Is that okay?
Yeah.
All right, perfect. I'm checking the chart. I am providing privacy. I am washing my hands. Can I see your name, ma'am? Can you tell me your full name and date of birth?
Zachary Miller, 7/26/93.
Perfect. Okay, so before we start, are you on any current medicine?
No.
Are you allergic to anything?
No.
Are you currently experiencing any type of pain?
No.
Okay, perfect. So we're gonna start with the head. Have you had any recent head injuries, any masses, any lesions,
No.
anything you're concerned about?
No.
Okay, perfect. So I'm gonna start by palpating the head. Okay, any pain?
No.
Okay, the head is normal cephalic. There was no masses or lesions felt. His skin color is appropriate for age and ethnicity. I'm gonna have you remove your glasses for me, please. First, I'm gonna start by palpating the sinuses. So we're gonna start with the maxillary. Any pain?
No.
Okay, and the frontal, any pain?
No.
Okay, I'm gonna palpate the temporal artery. Okay, it's a 2+ and equal bilaterally. Then we're gonna go on to your TMJ joint. One open and close, side to side, front and back. Any pain?
No.
Okay, there was no clicking, no rubbing. Everything was normal. Patient denied any pain. This also checks for cranial nerve 5, which is intact. So next we're gonna move on to facial sensation. So if you close your eyes. This is sharp. This is dull. I'm gonna move this in different areas of your face. You're just gonna tell me what you felt and where you felt it, okay?
Okay. Sharp left cheek. Soft left forehead. Soft right forehead. Sharp left cheek.
Okay,
Right
perfect. Perfect. Okay, so patient had sensation in all places of the face that were touched. So this also states that cranial nerve 5 is intact. So maybe close your eyes real tight, open them, and smile, and frown. Okay, and puff out your cheeks. Okay, all facial expressions were symmetrical. There was no drooping, nothing abnormal visualized. This also checks for cranial nerve 7, which is intact. Okay, then now we're gonna move on to the neck. Have you had any recent neck injuries, any pain in the neck?
Mm-hmm.
Nothing you're concerned about?
No.
Okay, so I'm gonna check the trachea to start. Okay, the trachea is midline, there's no deviations, no pain or tenderness felt?
No.
All right, I'm gonna go behind, we're gonna check your thyroid. So go ahead and tilt your head forward for me. All right, just palpating the thyroid, go ahead and swallow. Any pain or tenderness?
No.
All right, so the thyroid is symmetrical. There was no masses or lesions felt. We're gonna check all of your lymph nodes. So while I'm doing this, just let me know if you feel any pain or tenderness, okay?
Okay.
All right, we're gonna start with the pre-auricular, post-auricular, tonsillar, occipital, superficial cervical. Okay, go ahead and tilt your head, and deep cervical. Other side, deep cervical. Okay, we're gonna do posterior cervical, supraclavicular, submandibular, and submental. Any pain or tenderness?
No.
Okay, so there was no lymphedema felt or notated. You're not experiencing any pain?
No.
Okay, so next we're gonna go on to the ears. Any trouble with hearing, any pain in the ears?
No.
Okay, so on initial inspection, patient's ears are symmetrical in size and shape. The top of the ears are in line with the outer canthus of the eye. All right, I'm gonna check your ears. Actually, push on the tragus. We're gonna pull on the pinnas and push on the mastoid process. Any pain?
No.
Okay. Next, I'm gonna check the inside of the ear. So there is minimal cerumen. There is no foreign bodies. The outside of the ear, there's no swelling, redness, no pain?
No.
Okay, patient denies any pain. We're gonna check the other ear. Okay, there is minimal cerumen There's no foreign body, there's no swelling, there's no redness, any pain?
No.
Okay, patient denies any pain. So now we're gonna do your hearing. So I'm gonna stand about 5 feet away. All right, and I'm gonna cover one ear. I'm gonna whisper 2 words to you. As soon as you hear them, just repeat them right back to me, okay?
Okay. Red. Blue.
Okay, switch ears.
Green. Yellow.
Perfect. Okay, patient was able to hear and respond with appropriate words. So this states that cranial nerve 8 is intact. All right. So since patient was able to hear, there's no reason to perform a RIN or Weber test, but a RIN test would be using a tuning fork, hitting it, placing it in front of the ear, and then once again for ear conduction, hitting it again, placing it on the mastoid process, and that's for bone conduction. Ear conduction should be heard 2 times longer than bone. And then you would, for the Weber, you would hit the tuning fork and place it on the top of the head. All right, next we are going to move on to the eyes. Have you had any issues with the eyes, any excessive drainage, any pain?
No.
Have you had a recent eye exam?
Yes.
And everything was normal aside from wearing glasses?
Correct.
Okay, so patient does wear glasses. Patient has had a recent eye exam. On initial inspection, patient's eyebrows and eyelashes are intact. I'm looking at the cornea. There is no opacity is notated. The sclera is white. Can you go ahead and pull down your eyelids and look up? And pull up and look down. Okay, the conjunctiva is pink, moist, there's no opacities. The pupils are round bilaterally, and they are about 4 millimeters. So next we're going to check pupillary reaction to light. So you're going to focus on something behind me, and I'm going to check for direct constriction, perfect, and consensual, perfect. And then the other side, go ahead and keep focusing, direct and consensual. Okay, patient's pupils constricted equal bilaterally. So next we're going to check for accommodation. So go ahead and focus on something back there. You're going to focus in on my pen and follow it all the way into the nose. Okay, perfect. Patient's eyes converged and constricted bilaterally. So patient has perla, which checks for optic or cranial nerve 3. We're going to go on to the 6 cardinal gazes. So I'm going to have you follow the pen with just your eyes to the 6 different locations, okay? Okay, perfect. Patient was able to follow the pen to each 6 locations. There was no abnormal eye movements. Did you have any pain? No blurred of the vision?
No.
Okay. So because patient was able to perform this correctly, this states that cranial nerve 3, 4, and 6 are intact. And since patient has had a recent eye exam, there is no reason to perform a Snellen chart, which checks for cranial nerve 2, which is intact. All right, so 2 more aspects of this assessment and then we're done. So we're gonna check the mouth. So I'm going, any issues with the mouth, any pain, any swelling, any redness, bleeding?
No.
Okay, perfect. So I'm checking the lips. The lips are symmetrical, pink, moist, no lesions. Go ahead and open the mouth. We're checking the gums. The gums are pink, moist, no masses or lesions. Teeth are intact. There is no obvious dental work. The buccal mucosa is pink, moist, no masses or lesions. Go ahead and stick your tongue out. The pharyngeal wall is pink, moist, no masses or lesions. Tonsils are a +1, no protrusions, pink and moist. The uvula and soft palate are pink and moist, as well as the pharyngeal wall is also pink and moist. The hard palate as well, pink and moist, no masses or lesions. So I'm going to Have you stick your tongue out and say ah. Okay, perfect. So patient's soft palate and uvula moved appropriately midline. There was no deviation. And he had a good gag reflex, which checks for cranial nerve 9 and 10, which are intact. Go ahead and stick your tongue out. Patient's tongue is pink and moist. Go ahead and move it side to side, and then go ahead and say right tight dynamite.
Right tight dynamite.
Okay, patient was able to appropriately verbalize and move his tongue side to side. This checks for cranial nerve 12, which is intact. Okay, last part, we're going to check your nose. So on initial inspection, the nose is of normal color for age and ethnicity. There's no redness, no swelling, no masses or lesions notated on the outside of the nose. We're going to check the inside. Okay, there's no obvious deviations of the septum. There's no polyps, no foreign bodies. Inside of the nose is pink and moist, no excessive drainage. You've had no injuries to the nose?
No.
No pain? Okay.
No.
So we're going to check the patency of your nares. So go ahead and close one side, breathe in, and out, and other side, in, and out. Okay, perfect. The nares are patent bilaterally. So then last, I'm going to check your sense of smell. So I'm going to have you close your eyes. I'll have you smell. And what do you smell?
Cinnamon.
Perfect. Okay, so patient was able to appropriately smell, and it was correct. So this checks for cranial nerve 1, which is intact. Is there any other concerns, any questions you have for me?
Nope.
Okay, perfect. Here's your call light. I am moving the bed to the lowest position. All right, you have a great day.
Thank you.